I think that the pharmaceutical industry is actually having a turnaround. Right now, probably the biggest advocates of getting rid of the animal model, ironically, comes from Big Pharma. Right now, you can read almost any drug discovery magazine, peer-reviewed magazine type of articles, almost anything about the pharmaceutical industry, and some scientist at Pfizer or Glaxo or somewhere is saying that the animal model doesn't work. So I have found that over the last 10 years, pharma is being forced, because of financial considerations, to abandon the animal model. And what they're now saying is that the only reason they're continuing it is because the government requires it. So I think that has been a huge turnaround over the last 10 years.
Why you think government insists on it if it's are so poor, the result is so poor for human health?
There are a lot of people that make a lot of money from animal experimentation. Most of those people are not in industry, but are rather in academia. For example, in the United States, every grant that goes to animal-based research, a large portion of that grant is given to the university directly, and that's free money. They can do anything they want to do with it. Whereas with clinical research or in vitro research or in silico research, that doesn't happen. So animal experimentation really is a money-making operation for academia.
What can break the vicious circle? Because you have seen it's an ongoing debate, and so far, unfortunately, industry and lobby wins.
You're right, money wins. But the only thing that can counteract money... You're right, right now, money wins. But public opinion can counter that. Elected officials want to get elected, and if public opinion is totally against them doing something, they won't do it. So the more education we can provide, the more likely that animal experimentation will stop. It'll stop for financial reasons, probably it won't stop for ethical reasons, but it will stop.
Can you tell me what are the viable other alternatives to animal experiments?
What we should be doing instead of experimenting on animals is studying human beings. Really, this is the way medicine has made progress over the past 2 centuries. Everything we do needs to be human-based. It can be in vitro, it can be using humans as...
We cut it out.
The reason that we have all the drugs and all the clinical breakthroughs that we've had over the past 150 years is because, by and large, one reason...
You can come close a little bit, because maybe it's better then. Okay.
What we need to do is start using human-based data and not animal-based data. If you want to learn about mice, you have to study mice. But if you want to learn about humans, you have to study humans. Now, that can be done through autopsies. It can be done through in vitro work using human tissues. There are a variety of methods that are currently not being funded very well, that if animal experimentation was abandoned, would be funded much more than they've ever been funded in the past, and we would see great advances in human medical care. That's the key. That's the key. Human-based research.
Tell me how these animal tests are, passion for animal tests, damaged of the AIDS research, because there are a lot of evidence that, if not that, many lives were saved in the past.
I disagree with the claim that the reason HIV-positive patients are living longer is because of animal models. In point of fact, protease inhibitors were based largely on in vitro work and human-based research. Animal models had very little to do with it. Almost everything is eventually tested on animals. But even if protease inhibitors had failed the animal tests, they would have still gone on to HIV patients because they look so good on in vitro work. So there's a difference between correlation and causation. And animal experiments are correlated with a lot of breakthroughs, but they did not cause those breakthroughs.